Thank you to all of you who are introducing yourself. It's so nice to see you all. We're so glad that you're all here. This is Returning to Work, a very important and timely webinar. And I am Emily Grossman. I direct the CBC Training Institute. And we are so excited to have you here today. And I am here with Dr. Banilivy, who is going to, in a few minutes, give us the webinar. But before we get started, I just want to read a brief introduction to Zoom. I know many of you know Zoom, but I just want to make sure you know all of the features that we're going to use today. So you will notice that you were automatically placed on mute when you join the webinar so that we can avoid distracting background noises during today's presentation. You're not going to be able to unmute yourself, but if you would like to ask a question, make a comment, please write it in the chat box and chat to everyone. And I will be reading off the chats to Dr. Banilivy and we'll be interacting with you in that way. Also, you should see the chat icon on the bottom of your screen, but if you don't see it, look on the right-hand side and click where there is a speech, well, more like the middle, and click where there is a speech bubble and the chat box should pop up on the right. We're going to make liberal use of the chat box today. If you experience any technical difficulties or issues with your connection during today's webinar, please also chat to the host. Just chat to the host. And our host today is Connor, and she is here with the McSilver Institute, and she is wonderful, and she will help you with any of your technological difficulties. So that's a little bit about how the webinar is going to run today. I'm going to do a few slides just to introduce how we got this grant and a little bit about the CBC Training Institute, etc. And then I'm going to turn it over to Max Banilivy. So Dr. Banilivy, can you please advance the slide one?
Yes.
Thank you. Okay, so we want to thank SAMHSA for giving us, the Substance Abuse and Mental Health Services Administration, for giving us a grant to provide training to all of you on self-care. We know it's much needed for our mental health professionals because you are taking on so much right now during COVID, both your own concerns as well as the concerns of your clients. So we're so happy you joined us, and we're so grateful to SAMHSA for creating these training opportunities for you. We can go to the next slide. So Coordinated Behavioral Care received the grant money, and we decided to collaborate with different organizations. Dr. Banilivy is here from WellLife. And I want to just tell you a little bit about CBC if you don't know about us. We're a not-for-profit organization dedicated to improving the quality of care for New Yorkers with serious mental illness, chronic health conditions, and substance use disorders through a health home. We have a very large health home, an independent practice association where we have about 50 member agencies, all kinds of community mental health organizations throughout New York City. And CBC supports all of them in many different ways. And we also have preventative case management services, such as our Pathway Home program that many of you may know about. So we can go to the next slide. And I just want to tell you a bit about our training institute at CBC. We are a training institute that really provides interactive, innovative, culturally sensitive training and professional development to New York State's mental health providers. We really try to work with adult learning theory and make our trainings as cutting edge and interactive as possible for our for all of you. We really work with evidence-based practices, and we really want to make our trainings the scaffolding upon which a successful, rewarding career of service can be built. So here are some previous trainings we've had. I won't read all of them, but we recently, in the last 6 months, we had a training on LGBTQIA+ clients. We had a training on anti-racism. We had a training on working with clients with borderline personality disorder. We did one on treating seasonal affective disorder, and Yeah, so those are just some of our trainings. And if you're interested in being added to our listserv to receive training opportunities, I'm going to put my email address right now in the chat box. And you can really reach out to me. My name again is Emily Grossman, and I direct the CBC Training Institute. So with that, I'm going to turn it over to Dr. Banilivy and let him do his wonderful training.
Good morning, everyone, and thank you. Can you hear me okay?
Yep, we hear you just great.
Perfect. We had somebody who had raised their hand, so I don't know if there was a specific question for you at this juncture. It came in the chat room.
Yeah, if that person wants to type their question in the chat, we'll address it as soon as possible.
Very good. Okay. Thank you very much, Emily and Connor and CBC organization and SAMHSA for providing these trainings to the community. We really appreciate it. We're grateful to be part of this. We, as WellLife Network, which is a very comprehensive behavioral health agency in New York City and Long Island, we're going to also be providing another training this coming Thursday on avoiding burnout and building resilience. We have provided some resources that are going to be shared with you at the end. And Emily will, I don't know if we already mentioned it, but Emily Grossman will share that with you. So again, thank you very much for being here to talk about a very important topic, not just going back to work. Some of us have, some of us haven't. I can, as a part of self-disclosure, I can tell you, ever since the pandemic, I was working full-time in the office, never stopped. Only very recently, because I was offered the opportunity, I started to work doing some remote work. So if we have a chance to talk about that, I'm hoping we do. I will share with you some of my personal experiences as well. This training in particular is set up somewhat differently because I think I find it helpful for people not to sit there for an hour and a half just to listen and see words on the screen. So I've set it up a little bit experientially because we all have had a lot of experiences during this crisis already. We're getting close to a year of this crisis on a personal level, on a family level, as well as certainly with work in terms of how we have adjusted, how our workplace has adjusted, and how administrators have. So along the way, in terms of doing these trainings, I'm going to be asking some questions and hoping that you will participate in these questions because it's really for you. We would like this to be a learning experience in terms of you thinking about where you're at with regard to COVID and the pandemic, and what are some of the adjustments that you have made already, what are some of the questions you have explored, and others that maybe you want to think about some more. So in this short time, what we're going to be covering: the challenges and new realities for frontline workers, managerial staff, and organizations adjusting to what is caused by COVID and the pandemic, which is what our focus is. And COVID, the virus, has really impacted the world globally in so many different ways. And the tragedies and the multiple losses of lives that everybody has experienced. And I think if you haven't already, you will be hearing someone about the whole topic of grief, which is so prevalent at this point. We did a training not too long ago on unresolved grief because in collaboration with Stony Brook, because many people have not been able to grieve the way they were accustomed to. So there's a lot of unfinished business in that regard, and there are a lot of emotional factors that people need to take into account. Today, our focus will be more on working remotely and saying that, well, if you're not working, you are not working at home. You are home during a crisis. So we're talking about everyone experiencing crisis in many different ways. and not just emotional crisis, and the crisis as a threat to our lives, and crisis in many different ways. So it's important to keep that in mind. So what has it really been like to work at home? I hope this will play. If not, we'll just go forward. So I'm going to click on the corner, and it doesn't seem to. Connor, is there something I need to be doing in order to have this play?
I think it might have been the thing that PowerPoint blocked earlier because it said there was a security error.
Okay, that's fine.
Max, do you have a link for it? Because
I'm gonna look. Certainly, I will have a look. I'm gonna share it. We're gonna share it with you so you can distribute it to everyone. We thought it would be really helpful to see when real people talking about their experience, and certainly I really like this cartoon, and my colleagues came up with it and it really kind of speaks to what some of the people may be feeling with regard to having people at home full time when they were not accustomed to it. And that includes our dear pets. So how has the pandemic affected everyone's approach to their personal and work life? This is one of the things we would like everybody to think about. It really has. The changes have been so dramatic. What people have been thinking and taking into account on a personal level and work level have been so dramatic, probably never experienced in most of our lifetimes. Nothing like this we have ever experienced, where the whole world, the whole globe came to a halt. That life as we knew it obviously changed, and the new realities are evolving. They started evolving from March, April, and still are, because we are in the midst of it. So some of the questions for us as we go forward: are you focusing on your physical, mental, and emotional health? Hopefully you are. Hopefully you are more mindful of it. And if you're not, it would be a good question to ask as to why not? What is that is really getting in the way of you thinking about those two very important areas in your life, and as in physical health, that we all had to really be very sensitive to and very focused on, but also our mental and emotional health that is so intertwined in what everybody is going through. So the question is, at this point, if you have, then think about what you did to care about yourself before the pandemic. Has the pandemic and the varying guidelines that impacted your patient, have the varying guidelines impacted your patients in this area? And to what extent? How did you compensate for this? How did you deal with this? How did you deal with this global event that was catastrophic? What have been the barriers and maybe the achievements? So what I would like everyone to do at this point, if you would please, is finding the right way of coping for yourself and staff and your organization, thinking about that. And did you find ways to cope that actually was helpful for you, yourself personally, your staff, and your organization? Were there some of these, were some of these actually discussed with your organization, with your colleagues, with your peers, and with your supervisors? How often do you have staff speak about what they are experiencing at your workplace? It may be remote or maybe in person, depending on the kind of organization you have. Have there been patterns and themes that have developed? What has come up as a result of all of these interactions and discussions? What actions have you been able to encourage? If I would like to just to take a minute and just articulate a couple of them as to what kinds of things have you been able to put in place more concretely?
Okay, we have a couple, we have a couple things coming in, or one thing coming in.
Okay.
Someone said during our weekly staff meetings.
Okay, great. Okay.
Yeah.
Anything else?
That's all I see so far.
Okay. So if you don't mind, everyone that is participating in this discussion, if you don't mind jotting down for yourself. listing
I
com-
see a few more coming in, Dr. Banilivy.
Good.
My agency provided virtual yoga as a form of self-care. I think we need to do more of this, is another person in what they said.
Okay. Very good. Thank you.
Bi-weekly staff meetings, take small breaks while at home.
Okay. All right. I'm just curious. Are there, during the meetings, are there discussions of the emotional factors that people are experiencing personally through their family and otherwise?
Yeah,
So that's a,
I see
go
some
ahead.
more coming in. Do you want me to read them?
Yes, please.
Sure. Our agency created a book club, weekly meetings, and scheduled in-person meetings if needed. We have weekly staff meetings and also weekly team meetings. Our agency offers different mindfulness groups. So it sounds like a lot of stuff. Weekly
That's-
supervision too.
Okay, and just perhaps even just we can accumulate this and send it to someone in terms of some of the things people are doing already that are found to be helpful. So I'm going to go forward right now, and just if I'm hoping that everybody had a chance to jot down a couple of things. The continuation of the pandemic, worsening of global picture with the introduction of this variant of the virus and slower introduction of vaccines have further dampened everyone's hope for recovery. I'm just curious if you could just report in the chat room if this is indeed the way your organization or your individual are feeling.
I'm not seeing anything yet in the chat.
That's fine. That's fine. So
I see one person saying just about the previous question, personal actions I have taken are a consistent Kundalini yoga practice and meditation. And Teresa says in response to your recent question, absolutely.
beautiful. Thank you. Thank you very much, everyone. More questions to ponder. Have you experienced increased fear as the pandemic continues to go on? What do we do about it? Has there been a positive response to the vaccines? What do you and your agency do to educate your staff about the vaccine? If you have any comments, please put them in the chat room.
I think we should just give everyone 1 minute to read the
Right.
slide again so that they can respond. I mean, I think the previous one, maybe?
Yeah.
Yeah. Okay. Traveling from New Jersey to New York on public transportation. I'm concerned about the reluctance of many people to receive the vaccine. For vaccine education, our CEO has done a great job of sending out regular information to educate us on facts versus myth, which is great.
Beautiful.
Yeah, our agency had several information meetings about the vaccine. Wonderful. Double mask up, Leslie says.
Okay.
Yeah. Okay, I think we can go on.
Okay. All right. So and some of the things that here I want to put these questions up because I think although some people may have thought about it, it's really nice to see it in visually. Because regardless of your position, whether you're first responders, managers, supervisors, work totally remotely, your schedule is blended or never stop going to work, like myself. Is that okay? So our perspective would be very different and maybe very different And it would be good to think about that in terms of how your perspective may have changed, and changing that perspective. Has it been in the positive direction or negative? Have we become sort of more empowered about certain things that we could do now, or we have become more despondent about the circumstances of life right now, particularly work life, as many companies have had to close their doors? This impact is felt the same and differently depending on your position, as I said before. Okay, number 7, how have you been preparing and protecting for the physical and mental, emotional health of your loved ones and your coworkers? So the preparation part is very important. Everybody benefits from it. So it will be really important to articulate the different ways that people personally and at the workplace have prepared and are preparing going forward, because this doesn't seem to be changing. It's changing in some ways, but it doesn't seem to be going away. So all of us are forced to continue to deal with it as we had before, because the risk hasn't really significantly subsided. Is there anything, I would like you just to write down, is there one thing that maybe you learned about yourself? I just want you to think about it and mindful of. Did you learn, or what did you learn about yourself during this pandemic?
Someone said, yes, I can eat. I like the humor. I can work from home very effectively, Teresa says.
Right.
Yeah.
Good. Good. So there could be certainly positive things that come out of it, right?
I see one more. Do you want me to read it?
Sure, please.
I can work from home very effective. Oh, we said that one. That nobody will do for me but myself. I learned I can adapt quickly when necessary. I was doing more exercise before, Lizette says.
Doing more
Before the
exercise than now.
Yeah.
Which is something that comes up because people maybe were accustomed going to gyms and other more social places, that maybe that is certainly is not as available. Some places have become more open, but certainly not to the extent before.
And Margaret says, I learned I wasn't spending enough time with my child. I'm grateful for the extra time.
Great. I really appreciate hearing some of what is not necessarily negative, because it certainly has been a lot of negative. Certainly when you look at a lot of the media presentation, what we heard the first few months and still is all about the reports of fatalities and the loss of lives and so on. It really also is very important to counterbalance that, to look at how people's lives, both personally at the workplace, may have been affected in a positive way. My experience with what I went through when we went through the shortage, and that I had to go to the store at 6 o'clock in the morning and stay in line and just be told they are rationed out. Either they were out of, or they could be giving me one roll of toilet paper. That made me think. And I'm wondering, what did it really teach us? What is it that we'll learn that scarcities can come, and come in a very unpredictable way? Is the answer to it as though for us to go and fill up our pantries and have a doomsday mentality going forward? Is that really what we are learning from this? Or there are other ways to approach this, both at the government level, at the agency levels, and also at the personal level?
So Leslie has learned patience,
Okay.
more empathy, I have been more creative. Someone else, Eric says, I've been more creative in my approach to supporting our program participants. Yeah, and there's been a request, if everyone could chat into all panelists and attendees instead of all panelists, then everyone can see the answers. Karen says, we are learning about the importance of supporting each other and each other and the community.
Beautiful. Thank you.
Mhm.
Thank you very much. Please take a couple of minutes to answer the following two questions related to your experience with and since the pandemic. What did you learn in your personal life? If you can just write down 3. And what did you learn about your work life? I'll just take a minute. And those of you, after you finish, if you would like to report out, would be grateful to hear them.
Yeah, so I see someone says checking in more with friends, family, and coworkers. Someone else says, I love living alone. I have learned how important communication is in both my personal and work life.
Right.
Yeah, so that's what we have.
Okay, very good. We'll just then go forward. And I hope you take more time and finish this for yourself, right? Now, if you said some of the following, you're not alone, because we did a survey at WellLife Network some time ago, and we asked the staff, number of staff, to think about what they may have learned in the process. So I put down many of the comments that we have received from people. So some people certainly said, I learned that I'm not going to take things for granted anymore, because we can't. It can turn around so quickly. And asking what matters most to me, to us. And many people have said, thought about what work means to me. Why do I go to work? What function does it serve? Particularly that is juxtaposed for those people who are forced to work from home or had the offer and choice to work from home, knowing, okay, going to work, what does it mean? And as we'll get to kind of see it later on as a question, is that, do I really want to go to work? Do I want to work the same way as I did up to the pandemic? Changes and transitions can be very challenging, but it can be done. Because one thing that we know, that great majority of people and great majority of workplaces have made adjustments. So we don't know yet as to whether all the adjustments were going in the positive direction, but they were all be labeled as being negative. One thing that it was said here, and we hear it more and more and all the time, is that human connections are essential. People say it very often. They say, oh, I miss going to work because I miss just being around other people. But I miss that morning connection, just saying hello, having a chance to report to someone about my weekend was. People actually miss that water fountain conversation. They say they really miss that. There was a lot of connection. There was a lot of learning going on. There was a lot of exchanges of information that was taking place. Not that it cannot be done virtually now through technology, but it has a very different feel to it. So number 6, people are learning that they are more adaptable than they thought they were. This was clearly a catastrophe. This continues to be a crisis in our work life and our personal life. But for people to be able to say this, we're all adaptable. We can adapt to some of the toughest situations. So I want to pause here a little bit and ask you, did you find yourself, if you think about you, or in the previous questions, did you respond as though you adapted relatively constructively, with difficulty, with stress, with anxiety, with some fears, but did you adapt? Do you feel like you adapted, or you're still in the crisis mode? And this is a parallel question for agencies, companies, and administrators. Did your agency, did your system adapt already to a new reality? Are you in the midst of it? So where are you on the continuum of adapting? And what are some of the things that you felt like you have adapted to? Aside from, yep, we have all kind of adjusted to wearing masks and washing our hands a great deal, socially distancing. But aside from that, what have we adapted to personally and from a business point of view?
So
Are
Dr.
we approaching things differently?
So Dr. Banilivy, Elizabeth says, absolutely. I feel that I adapted. I was able to use new technology that I did not use before. And let's see, Leslie says, listening more attentively, which is also a really good one.
Okay.
And that's all we have so far.
Okay, very good. Thank you. We can learn to become more resilient even in the toughest times, which is something we will talk about on Thursday, when hopefully some of the participants today can still attend that. Work-life balance may be more of a focus. Probably more than ever before, people are thinking about the balance between work and life. How does that mean? Go ahead.
Sorry, Dr. Banilivy. We have a few more coming in. Do you want me to read them?
Yes, please.
Okay, I see Eric says, I was having difficulty in the beginning. Once I accepted that things have changed and may never be the same. Hold on. I was able to adapt. And Sharon says, becoming more comfortable with being on video. And I can relate to that one.
You know what? In my case, I had to make an adjustment because my voice is usually very low, the volume. So people kept on saying, you got to speak out louder. You have to speak louder. So I learned to speak louder. I had to adapt and adjust, and it was a good thing. Crisis times are opportunities for thoughtful change, advancement, and growth. I am not sure if most of us, frontline, senior administration, it doesn't matter. If most of us, when a crisis happens, and this was a drastic one, and it still is, that when something like that happens, that we say, wow, I can learn something from this. Not that I'm forced to learn something from this. Yes, we have. But I can absolutely learn something from this. This is the nature of crises. Forces everybody to focus on their injury, emotionally and otherwise, their losses, what they were used to, what they were accustomed to that is different. We don't like things to be different unless we choose voluntarily to make it different. When it's imposed on us by others, and certainly by this virus, we don't like it so much for a good reason. But again, it forces everybody to focus on the negative. So what the world of work looks like now, what have employers done differently? There is anticipation that the impact of the pandemic will be having not only it will not be temporary, but permanent. It will have a permanent impact in the world of environment, in the work environment and workforce. What is some of the data that we have so far and it may be changing as we go along, that about 60% of work, 60% are working from home after the pandemic. 88% increase in concern than before about safety and health. So one can look at it both ways. That at almost a great majority of us are focused more and more on our safety and health, but there may be a silver lining here. That maybe if we make this permanent, more of us may be attending to our health a little bit more than we did before. So there may be some benefit that comes out of this. 50% expect flexible work arrangements to go forward. So what we were forced to maybe take on, depending on what were our circumstances, that maybe it will turn into an expectation that more and more of the workforce will want to and will expect more flexible work. And this is on part of the workers and employees. And it may be actually, I will get to that also, that it may be on the part of the employers also, that they will incorporate more of the flexible work arrangement. As many as 80% have been formally been provided education already about working from home. So this has become standard, if you will, and going forward. That is a standard and a flexibility going forward on part of the senior administration, agencies, and organization, as well as an employees, to have this in mind going forward, that this may be a possibility depending on my position and the circumstances of my company. 65% expect and anticipate general employees to have more stress and anxiety in the work environment. Is this your experience?
I see someone saying yes, Teresa. Yeah.
Okay.
Marlon says yes.
Yes. Okay. So if indeed the statistics show it, and in real life, and we experience this, we know that people talk. The conversation we have at work, whether they're virtual or otherwise, is a lot about our continuing anxiety and stress about what's going to be like, what else we have to deal with, the uncertainties. 60% have made adjustments to an onboarding process as part of the HR process. So the HRs in every organization are looking at onboarding and many other factors. 35% believe changes are going to increase productivity. So I would like to ask you, do you think these changes that the organizations and the workforce have already taken on have resulted in more productivity? The other question embedded in this is, are people, employees and frontline workers and otherwise feel like they're actually more efficient in their work with this new system, or actually has a negative impact? I would like to hear some comments if you care to share.
Okay, Teresa says that Teresa is so much more efficient.
Okay, anybody else?
I'm not seeing anything else yet in the chat box, but I'll
Okay.
let you know.
All right.
We have one more. Jody says, I feel like my department is more efficient.
Okay, very good.
And Elena, should I keep going?
Absolutely.
Elena says, I think this has created somewhat of a negative impact because it seems people will need to adapt to returning.
Okay, so for some people, it may be that they are expected to return to work. For them, it may be different than those who are given the flexibility or a blended system.
We have a few more coming in.
Please.
One is Teresa says, I prioritize my day. I'm accountable at the end of the day. I spend less time at the water cooler.
Okay.
And And Kevin says coworkers who struggled with time management before have generally made improvements in meeting deadlines, etc.
Beautiful. This brings up a lot of issues, as I see. That's why I paused on this, because for some people, this is good for self-examination. Because I can share with you, I needed to go, once I started doing some remote work, I realized in my head, I needed to make adjustment. I missed like the coffee machine at work, because the coffee machine at home is not the same. I missed it. So I think in some insidious ways, I experienced certain losses not going to this building that I've been going to more than 25 years, that just making that change was somewhat stressful, and still is taking some work for me to work toward perhaps even being able to full-time work remotely, because my work allows it to happen. So I think the whole issue of productivity, obviously many supervisors, managers, senior administration would absolutely be concerned about, certainly with frontline people, certainly when we provide services to individuals. But that is a very rich area to examine, because there is some literature in the human resources literature which talks about productivity efficiency. So the same question is that, do we feel like all of us are more or less efficient at home? And that's a question that can be asked in different contexts with different groups of employees. 65% believe that changes they have made are having a positive effect on their work culture. That's a significant number. That statistic is significant. And that there may be a lot of things that go into the work culture, but what do you think that the reason is for that positive effect? Is it just giving people more freedom in a sense of working from home? Is it more flexibility? Are there other things?
Okay, we have a few people jumping in. Would you like me to read them, Dr. Bell?
Please.
Okay, so Eric says, I have become more efficient and also realized the importance of separating my work life from my personal life. Then we have Leslie, who says, Leslie is more efficient at home than in the office with this new way of life. Kevin says, depends on the day, week, month. I have more uninterrupted time at home for now. And Eric says the importance of self-care. Teresa says the upside is freedom and flexibility. The downside is lack of contact with humans. I really relate to that, Teresa.
Yes.
And Karen says, I'm more efficient at home as there are less distractions. It helps with time management.
Okay.
Marlon says it is a challenge for me, especially when you have kids who are doing remote learning. And I've heard that a lot.
Yes, I have too. Thank you.
That's all we've got.
Thank you very much. Okay. What are some of the things that companies, organizations, and agencies are reviewing? They're reviewing certainly staffing, schedules, liability issues, fiscal retention, data and security. Recession, bankruptcy is a concern for at least 50%, fearing not being able to recover or have severe cutbacks. I would imagine a significant number of the workforce in your agency worries about cutbacks. I'm just wondering if you can give us some feedback. Anyone?
Not anything yet.
Okay, all right. Additionally, decisions about furloughs, layoffs, pay issues, health plans, and COVID-related coverage engage many industry. These are certainly paramount at this point. Again, 79% in this particular data collection, considering remote work. So that's a very significant number. 60% considering staggered work schedule and 50% changing office layouts and considering the need for real estate in general. Many companies may be considering downsizing in terms of real estate as a result of the fact that may have 50% or 60% of their workforce and certain kind of workforce that they can absolutely work as well at home than coming to a place. There are maybe a lot of savings, not just real estate. There may be overhead costs otherwise that the agencies may be saving as a result of it.
And Dr. Banilivy, lots of people are saying that cutbacks are a concern.
That is a major concern. That's what I hear often. That cutbacks are a big concern, which really comes back to one of the comments about people thinking about this work-life balance. If we always have to worry about kind of thinking about it, if we work for someone, that risk always exists because business changes all the time. There are mergers that happen. We hear that about corporations all the time, where a whole department are eliminated because there's no need for that particular specialty or workforce or the numbers. So that's a point well taken. Cutbacks are continuing to be because agencies are in the evolution. And as I said before, companies are in different phases of this change and or growth, if you want to use the terminology of a growth, and in terms of thinking about how many people I need for this particular job or for this particular department. And that is a conversation that people are having at many different levels. So the health consequences and the crisis aspects also really kind of bring a lot of psychological issues to the forefront, more than ever before. Not that it didn't exist before, but more than before, because has made it front and center. So if I were to ask you, in terms of your connections and conversations with your colleagues, superiors, supervisors, what is the number one emotional challenge for everyone? What would it be?
While we're waiting, I'd like to jump in and say loneliness.
Loneliness, very good. Okay. And by the way, it's wonderful you bring that up because the crisis in the society going forward is loneliness. So COVID exacerbated an already existing concern, and loneliness, which was historically a concern with the elderly for a very, very long time. Loneliness, even for not the other age groups, has become a major issue because technology has taken over. We would think that technology 24/7 being on a cell phone, Snapchat, or whatever, FaceTime, you would think that we are more connected. Ironically, we are more connected technologically, however, we are lonelier. So what is missing in this picture?
Yeah, and Dr. Banilivy, I see other people agreeing that it's solitude. One person is saying, Lisa is saying people have lost their social skills, adapting to communicating via devices rather than in person, which is what you're saying. And Teresa says what's missing is touch. There's no one to hug.
Yes. Well, touch is tricky, right? touch, well, certainly now touch is very tricky for other reasons. But for those who are comfortable, they're good friends or what have you, and it was comfortable, I don't have to get into talking about the value of touch to even other animals, not just human beings. So isolation, loneliness is primary. So if we're going to work, and this is what I'm postulating going forward, if 50% of our workforce is going to work at home, of that cohort, one would think the experience of loneliness is going to get worse.
And Dr. Banilivy, Eric is saying that body language is missing. And I really agree with that too.
Body language?
Yeah, you're not able to really see the full, like what people are communicating unless they put their hands up like I'm doing right now.
Yes, I do that all the time. People tell me, hey, are you from Italy? Because you're talking with your hands. Okay, all right. So what have we experienced aside from the point so well taken with regard to loneliness and obviously fear of dying, getting sick, whether I'm going to survive it and everything else. And we know primary concerns reported by workers and staff is fear and despondency, along with consequences of profound grief and losses related to COVID. And one of the things that we mentioned before was unresolved grief is going to be with many people for a long time to come. So what have we seen so far? The over time, particularly in the first few months of the pandemic, I wonder why we had such a significant increase in use of psychotropic medication. Why do you think that was? Anyone?
Nothing yet in the chat box about that.
All right. Anxiety was on top. People taking an anti-anxiety medication, people taking sleep medications, certainly people feeling depressed about the whole world turning upside down. Many people who lost jobs, many people are out of work right now. So very significant. We have, sadly enough, we had increased number of completed suicides and also very significant increase in terms of people who tried to kill themselves as a result of the circumstances. So this becomes something for us to be sensitive as employers, as supervisors, and us ourselves being more mindful of our emotional well-being, because the changes have been so drastic and some people have been profoundly affected, where they had to work 2 or 3 jobs and 2 of them disappeared. They're non-existent at this point.
So Dr. Banilivy, we're getting a lot of responses to this. Jody is saying this is an ongoing global pandemic and beyond most of our scope of typical coping skills. And then Teresa is saying overdose deaths have increased significantly as well. And there's someone else is saying there's an increase in symptoms and decrease in resources and human connection. And Jody's also saying, and I think this is interesting, in a way, this is like soldiers going to war. We are all trained in some way to cope with stress and anxiety, but then we hit a wall where it is just too much.
Wow. You know, I love that. We should give her some brownie points. That's a wonderful analogy. Yes. Thank you. Thank you very much for feeling comfortable enough to share. We had the liquor stores, especially the online ones, they have a field day with the pandemic. They sold so much more liquor during the pandemic. And we're not going to get into it here, but you can imagine why people are using so many prescription medication and non-prescription medication and other substances aside from alcohol as a way of dealing with all the stress. What to keep in mind with regard to signs and indication that stress and other emotional consequences bring. So what do we look for in others? What do we look for in our coworkers? What do we look for in our employees? Being more irritated, angry, lack of motivation, concentration, feeling overwhelmed and anxious, sad, trouble sleeping, problems with appetite, worsening of health conditions. We know for a fact stress worsens many health conditions. So we need to be mindful of it. So these are things that we, as well as other people that we work with and other people that we live with, we need to keep this in mind, is this is an impact of a crisis. What we may be worried about related to and actually going back to work. So if I'm going back to work, if I have to, as Emily said, if I have to go to work, some people have to go to work. Am I exposing myself and my loved ones to COVID? Will there be enough safety at work? How do I know my employer is really having this as a main priority? Will my job be cut? We said that before. Will I be able to take care of my family? How will others respond if I said I had COVID? Would they have false information? Or there is not really definitive information. So would I continue to worry about, would I stay away from a colleague at work that has had COVID? Let me hear from you.
I do see that Juliet is saying domestic violence and child abuse is on the rise as schools are closed and parents have more stress.
That is correct. Thank you very much for sharing that piece of information.
Yeah, and Lizette says, I worry about taking public transportation. Trains get overcrowded. How safe is that?
Okay. I just remember that I should be mentioning, by no means, I hope it's obvious that we're trying to be exhaustive in this an hour and a half. I'm just trying to touch upon certain relevant concepts and issues. What are employee concerns to be considered by the employers and managers? Safety, others coming to work sick. Do I want to work remotely? What happens if I don't want to return to work? My kids are remote learners. It was mentioned I need to be home for them. Issue with PTOs, job and responsibility changes, because that has happened. So there are shifts, and that shift or changes may not be to people's likings. And a lot of the redesigning of work and workplaces and work departments and so on.
And just a few comments here. Lizette says there's no such thing as social distancing in hospitals.
Right.
Yeah.
Yes, that's absolutely true.
And
That's absolutely true. You just have to, go ahead.
Yeah, and unfortunately, Elizabeth says multiple colleagues had COVID, sometimes even twice. I know everyone is doing their best to stay safe, and we all have PPE.
Yes. Thank you. Thank you very much for sharing. Do you feel like the pandemic was traumatizing?
A lot of people are saying yes, absolutely, yes.
Please take a minute to rate your workplace. I'm actually asking you to focus on your workplace on a scale of 1 to 5, as 5 being most effective in coping with the COVID, and weathering all the ongoing changes. What did your agency do well? And what do they need to still work on? Please just take a minute to do this.
While we're doing that, I really want to thank people for all of your participation. It definitely makes the training go really smoothly when people are really responding. And I know we're in a different format where we can't be face to face, which is what I think I love. And I know Dr. Banilivy said he loves that too, but it's really nice to have all of your participation.
Right.
Okay, so Leslie is saying keeping us informed, that I guess this is something they did well, keeping us informed weekly or daily if needed. Lisa is saying we had check-ins often with all teams and supervisors, both personal and work related. Check-ins. Teresa is saying they did what they did well, allowing employees to work from home. Our agency has addressed the importance of self-care. The agency converted to telehealth quickly and they gave the staff enough time to adapt. That's a good one.
Very good. Yes.
And Marlon says morning and end of the day check-in with staff. Karen is saying that agency acted quickly, provided PPE and went remote, gave updates regularly and took action.
Thank you, everyone. Thank you very much. Trust ends up being number one on the list. This is not that this did not exist before in terms of communication about emotional issue, but that has been brought to the front and center, that emotional issues in general have a very strong impact on the workforce and the workplace. So these are some of the things that the employee says, just, taking the time, allowing the time, showing interest and inquiring, trying to understand that everyone is affected and somewhat differently, sharing of experiences and reframing where possible, always focusing on the strength. We can't possibly avoid negative news. We can't possibly stop our worrying because it's almost constant, but it's important to balance it. Use trauma-based language and communication. If we do, most of us agree that we say many people are really seriously traumatized, and many people actually need services because they were traumatized as a result of all these changes. Then we need to kind of learn more of a trauma-based language and communication with our employees and with supervisors, with everyone within the workforce. Encouraging social connectedness, as we talked about this already, when possible, okay? So the get-togethers do not have to be physical, in the physically present. It could be virtual. People don't have to always have meetings just for work. Sometimes it's just not, happy hour, Friday afternoon, maybe, or another time, maybe checking Monday morning with regard to connecting everyone. And helping people, not only agencies themselves setting the clear boundaries, but helping people set boundaries in all respects, including with their anxieties and worries, so it doesn't get out of control. These are just only some of the resources that are available to everyone. I hope everybody knows about Emily's, that wonderful list of self-care. I don't know if all of you know. If you don't, you should know about it and ask her if she would share it with everyone, because it's just a wonderful list.
Thanks, Dr. Banilivy. I can put it on the website, on the CBC website.
Thank you. Thank you.
Of course.
I think focusing on the healthy habits and routines, when we have such a blended organization now in terms of the routines are different. This is so profound in terms of people dealing with crises, focusing on something they have control over, the things that they can do something about, rather than the constant worrying that never ends. Set small goals, right? Those of you who are in the leadership and senior administration, anything anybody wants to add to this? Some of you supervisors, other things you think is important to include?
I'm seeing people are saying the serenity prayer was said a
Right.
few times.
Yes.
Let's see, setting a schedule and boundaries is of utmost importance for myself, someone is saying. Yeah, so those are some of the things.
Okay. All right.
Encourage people to take time off is another one, Lisa.
Absolutely. You know, it goes back to years ago when I still do some of that, but when I was working with interns, and I say that I would want them, I encourage them, and also the staff that I was responsible for, that I would say, you need to take mental health days. It's not a negative reflection to take mental health days. It should be like anything else. So maybe we should label one of the PTOs every 3 months as a mental health day. Well, I guess there are basically personal days that are, we can label them as mental health days. So these are some of the skills to promote. How do we encounter it? A list like this, it clearly can be promoted and put on a flyer and shared with people, making sure people schedule time to play. In times of stress and crisis, it's important for us to schedule to do this. Be more organized, develop strategies ahead of time, get support when we need it. As it was already mentioned, some of these activities, mindfulness, yoga, visual imageries. Maybe limit your exposure to people who are constantly worried and always thinking about what else could happen that could make things worse. And these are some of the principles. And I assume some of these are on your list.
I'm just looking. Yeah. Yeah, a lot of
There
them.
you go. Okay.
And we're getting some real comments in the chat box. One person is saying music is a universal healing tool.
Yes.
One person is saying it's so important to provide time and space for these things to happen at work.
Yes. And I know of at least one organization that something like that has been set up as though as a place that people can go to regroup, center, meditate if they want to. Does this title surprise any of you? Post-traumatic growth? I really like this saying because I hear all the time, I love the snow. You know, I was out at the crack of dawn shoveling and enjoying the white powder. It was so nice, but some of us hate the snow, hate the rain, and any change to the weather, aside from being sunny and comfortable temperature, that throws us off. And if that's the case, that's something we need to really work on. I would like you to think of the hardest thing that happened to you in the past. You don't have to share this. I just want you to think about that personally in your head. You can share if you wish. Did you think of one? As a result of that, what did you learn about yourself?
Eric is saying resilience.
Okay. Any other?
Marlon is saying that I'm stronger than I realized. Elizabeth is
Nice.
saying yes, resilience. I can make it through tough times, Doris is saying.
Beautiful. Thank you. You know, we know that there are some agencies that are more resilient than others. Prospectively, the more resilient the organization becomes, the better they'll be able to weather, right? Challenges that are still going to come in different way. Hopefully there won't be a challenge like the COVID or the pandemic, but we never know. Every once in a while it happens. The emotional health of any entity is closely intertwined with the emotional health of the individual employees. Hence, attending to the emotional needs of our employees is good business. I think everybody's going to get it, and I just want to put it up for everyone to read it quickly. The reason I thought it was helpful to put this on is because we can assume that everybody in our organization and our workers and employees were traumatized. Most people, it seems like almost at least 50% of people recover and grow from this because they make adjustments in terms of their relationship with their work and with their employer, as well as their relationship personally, their personal relationships. They may make adjustments that are better for them than they were before. I would like just in a couple of minutes we have left, I would like to ask you, just each one of you, to just create a action plan for yourself vis-a-vis your organization, in terms of what you would like to do different going forward in terms of your work life. And what would you like to communicate to your employer or senior administration as to what you would like to see different? Because if what you're asking for, it also benefits your organization, is a win-win. Why wouldn't your employer or senior administration want to hear about certain suggestions and ideas that will also benefit the organization, either at the present or going forward? Can you imagine prior to the pandemic, if a committee of employees would have come to the senior administration and said, you know what? A lot of this work that we're doing can be done remotely. Could we start doing that? What would it have been like? Do you think most employers would have said, oh, what a great idea? Perhaps. Maybe some would have and say, wow, there are some benefits. If there are benefits to my employees, there are benefits to our organization. So it's good to listen. Thank you very much, everyone. I apologize for rushing through this. We had only about an hour and a half. This is definitely worth a day or two of discussion about what's going on with all of us at so many different levels. Any questions or comments at this point before I turn it over to Emily, because she has some closing remarks?
I'm just seeing people are thanking you. I don't see any questions yet, but I'll give it a second. People are saying great information. Thank you, it was great. But not any questions. So I'm gonna just jump in and give people a little bit of information.
Okay.
First of all, this training, please stay on, because we're gonna now put the form that you can apply for CEUs. We are providing CEUs for social workers and I believe licensed mental health counselors as well,
Yes,
Dr.
yes, yes.
Yeah, so we'll put the link to the form so that you can fill that out right now. Not for peers. I see someone asking about that. So we're providing CEUs for social workers and licensed mental health counselors. You should see the form pop up there, and it will also pop up when you close out the webinar. And also we're going to email out the form to folks too, if you're not able to have time to fill it out now. But please do fill it out. That's the way you'll get the 1.5 CEUs. I also want to say that all the resources and the slides and the recording of the PowerPoint presentation will be available on the CBC website next week. So Connor, if you could post the CBC website link that people can go to get all of that information. And yeah, so it's cbcare.org, CBC Training Institute, that link. Next week, we'll have all of the resources and information that Dr. Banilivy shared. I also want to say, if you'd like to be added to our mailing list, please email me. My email is in the chat box. And if you have questions specifically about CEUs, I'm putting that email in the chat box. It's ceus@cbcare.org. So if you have questions about CEUs, please email that particular email and you can ask us questions about that. And I'm just looking to see if there's anything else. I think that's it.
And
So I want
may I mention something?
Of course.
Okay, it's very important in terms of us being able to issue the CEUs that the names have to be full name, please print. It has to be the way it appears on your license. And also your license number, please double check, make sure it's accurate, that your license number, because all of those need to be checked first before a 1.5 CEUs are sent to you.
Yes, thank you, Dr. Banilivy. And also, we're gonna cross-reference only people who were on the full training are eligible for CEUs. So we have a way of cross-referencing that. So just so you know, that's an important piece of information as well.
Thank you very
really-
much.
Yeah, I really want to thank you, Dr. Banilivy, for your wonderful presentation today. I know I got so much out of it, and people are really replying that they got a lot out of it too. So we're going to keep the room open today for just a few more minutes so you can collect all the links and fill out the CEU form application. And if you have any questions, email ceus@cbcare.org, or you can email me, egrossman@cbcare.org. And that's all we have for you. So thank you so much. And thanks again, Dr. Banilivy. And thanks to Connor, who did our admin
Yes.
today. She did a wonderful job as always.
Thank you, everyone, for your support and participation.